The people who have had coronavirus symptoms for more than 100 days have a nickname for themselves, the long haulers. They've been dealing with the virus for much longer than most of their peers and far longer than their doctors anticipated. As their illnesses persist without explanation, these patients turn to online support groups on Facebook, Reddit, and Slack, where they seek medical advice, swap war stories, and share updates on their health. "We're all kind of diagnosing each other," Peggy Gorley, a 56-year-old from Long Island who belongs to a coronavirus support group on Facebook, told Business Insider. "You'll hear someone else say something, and then you realize it's happening to you too." Gorley has had COVID-19 symptoms since March 5. When she initially got sick, she quickly developed a cough, fatigue, and shortness of breath. Her lips and eyelids turned purple. She tested positive twice, once in April then again in May. Her third diagnostic test came back negative on May 21, but more than 100 days after her symptoms started, most of them haven't gone away. "I try to spread the word around to other people that they should be very careful. This isn't a joke, and I'm still sick, and people can't understand," Gorley said. "The only place where I get my recognition that it's okay and it's normal is the group." Business Insider spoke to 17 coronavirus patients like Gorley who have been symptomatic for more than 100 days. Some have been in and out of the emergency room. Many are young, in their 20s and 30s. They're confused about why their symptoms have lasted for so long. Most of these patients' infections have drastically upended their lives. They've dealt with chest pain, shortness of breath, nausea, heart palpitations, loss of taste and smell, and other prolonged symptoms for months. Some are facing unemployment or having to file for disability as they stare down the barrel of chronic illness. Others have struggled to care for their children or family members. These cases could offer crucial information for those developing coronavirus treatments, formulating workplace policies, and issuing public health guidelines. But for now, these long haulers say they've been relegated to the shadows of the pandemic. At the start of the pandemic, the U.S. Centers for Disease Control and Prevention suggested that mild coronavirus symptoms typically lasted for 14 days, while the World Health Organization reported that recovery could last up to 6 weeks for severe or critical patients. More recently, both agencies have acknowledged that the coronavirus may have long-term symptoms, but neither has offered a timeline. We hear anecdotal reports of people who have persistent fatigue, shortness of breath. How long it will last is hard to say, Jay Butler, the CDC's Deputy Director of Infectious Diseases, said on a press call on June 25. Indeed, there are some people who have persistent symptoms, like a long-term cough, Dr. Maria Van Kerkhove, the technical lead for the WHO's pandemic response, said during a press call last week. They may feel quite fatigued for some time, may feel some shortness of breath while they're climbing stairs, but we are working to better understand what recovery looks like, and more specifically, and more importantly, what type of long-term care, if needed. But the stories given to Business Insider present a more harrowing picture than that. For Gorley, a trip to the grocery store means spending the rest of the day on her couch, struggling to breathe. Other patients reported getting out of breath from walking their dogs, playing with their children, or going to the mailbox. Some have barely left their beds in months. Just this past couple of weeks, I ventured out into the living room area, Cheyenne Bayer, a 27-year-old living in Austin, Texas, told Business Insider. The fact that it's been 3 months and I still don't know how it is going to progress or get better, it's just scary. Bayer has gone to the ER 3 times since February, when her symptoms started. She was denied a coronavirus test in March because she didn't meet the CDC guidelines at the time. After testing positive in April, her heart started beating more than 100 times per minute, a condition known as tachycardia, and her blood oxygen had dipped below normal levels. In May, she was admitted to the hospital overnight, but her blood work and chest CT scans came back clear. She still has an elevated heart rate, erratic blood pressure readings, and a low-grade fever. "If you look at my test results, I look healthy as a horse, but my symptoms aren't matching the test results," Bayer said. "Pretty much every doctor I've run across has tried to pin it on anxiety first, and then they just kind of disregard everything else I say." Bayer tested negative for antibodies in May. She said she cried. "The most frustrating part of this whole thing is there aren't any answers," Bayer said. "My primary care physician, she can't say with certainty that the first test wasn't a false positive, and she can't guarantee that the antibody test isn't a false negative. the damage versus the disease. Multiple patients told Business Insider that their primary care physicians have referred them to specialists, including pulmonologists and infectious disease doctors. But for the most part, those visits haven't yielded many answers. A lot of these patients get turned away. Dr. Ramsey Asfer, an infectious disease doctor in the San Francisco Bay Area, told Business Insider. The infectious disease doctor says, well, there's no evidence of any infection, and the oncologist says, you don't have a blood disorder or cancer, and the pulmonologist doesn't know what you have. So then you're left in this limbo. Asfer said part of his job is understanding infections that don't fit the conventional mold. He has seen college-aged patients with mononucleosis who have had severe fatigue for 2 years, or viral infections that trigger a lifelong autoimmune disease like lupus or rheumatoid arthritis. The coronavirus could have similar effects on patients, he said. Though the virus initially targets the respiratory tract, it can also invade the heart, kidneys, liver, intestines, and brain. That explains why the big 3 symptoms associated with the virus, a fever, dry cough, and shortness of breath, don't apply to all patients, and why symptoms such as dizziness, headache, diarrhea, and nausea have become additional warning signs. There are so many people getting infected that there are going to be a handful that react differently, Asfer said. Even if coronavirus patients don't have blood clots or permanent organ damage, he added, their immune system can still go haywire and damage healthy tissue. You have to separate the damage from the disease, Asfer said. The symptoms are probably coming from an immune reaction. But it isn't always easy for doctors to make that distinction, he added. It's going to be difficult to tell for now what subset is active, ongoing infection and what subset is really just pure immune dysfunction, Asfer said. When will this end? Research suggests that the majority of COVID-19 patients are most contagious during their first week of symptoms or just before their symptoms start. After about 10 days, the risk of infecting another person appears to drop off. People who test positive after 2 weeks of symptoms may be shedding dead virus, but it's tough to tell. My infectious disease specialist tells me that I'm 100% not infectious, but I'm not 100% sure. A patient in Westchester County, New York, who requested anonymity because she is also a physician, told Business Insider. I wear a mask in my house still when I interact with my family,